The classic image of dental school usually involves hundreds of students sitting in a massive lecture hall, taking notes and trying to memorize textbooks. Here, your first encounter with a new medical topic is a patient case. You are handed a real clinical scenario, complete with symptoms and patient history, before you have received any formal instruction on the underlying science. You and your group are responsible for identifying the unknown. You break the problem down, isolate the exact gaps in your collective knowledge, and then hunt for the answers yourselves. Walking into a room and not knowing the answer right away will feel uncomfortable. That friction is intentional. Working through that uncertainty is the exact cognitive process required to diagnose and treat real patients in a clinic. To navigate these clinical cases, you will use a structured roadmap called the 7-jump process. This is a chronological sequence of steps designed to guide your group from initial confusion to a synthesized diagnosis. Meeting 1 covers steps 1 through 5. Your team reads the case, clarifies terms, and debates causes to form learning objectives. The chair manages flow, while the scribe maps hypotheses on a whiteboard. Step 6 is independent self-study, researching those objectives using credible sources. If you show up to the next session without doing this research, the structure collapses. The ecosystem relies on each member bringing back specialized, verified information to solve the case together. That brings us to step 7, or meeting 2. The team reconvenes to share their findings, debate the evidence, and apply that newly acquired knowledge directly to the patient's problem. You will have a faculty facilitator in the room, but they act as a guide to the clinical thinking process, not a traditional teacher. They will not confirm if you are right, and they will not provide an answer key. This document outlines a pedagogical strategy known as wait time. Wait time 1 is a deliberate pause after asking a question, while wait time 2 follows a student's response. Facilitators use this intentional silence to force the group to process information and develop answers. They will also use a technique called cognitive pumping. This involves asking open-ended questions, like, "Why do you think that?" to push your reasoning deeper, rather than stepping in to correct you. When the discussion stalls and you feel lost, your instinct will be to look to the facilitator for a rescue. You have to resist that urge and lean into your group's collective debate to find the way forward. To succeed in this environment, you have 3 core responsibilities. First is to prepare. Review any introductory materials before the session and know exactly what is expected of your specific role, whether you are the chair, the scribe, or an active group member. Second is to participate. Speak up and throw out ideas, even if you are unsure they are correct. Listen closely to your peers and build your theories directly upon the evidence they present. Third is to reflect. After the case is closed, conduct a self-assessment. Ask yourself if the group actually solved the problem, if you contributed effectively, and if you truly understand the biological mechanisms at play. You must avoid falling into ritual behavior. This happens when students show up to the meeting and simply take turns reading their research notes aloud. Regurgitating text without digesting it destroys the active cognitive processing the session is designed to create. The IMU faculty knows this transition is demanding. You are going to feel uncertain at times, but decades of educational research show that students who train in this environment retain knowledge longer and perform better in clinical settings. By trusting the 7-jump process and embracing your role as an active problem solver, you develop the clinical judgment, adaptability, and professional reflexes required of a practicing dentist from day 1.